Yeah, it's fun.
Did you guys watch the video for it?
Yeah, I did. And I think the video basically just, like, the second article, but because there was, like, kind of two articles on the PDF.
Yeah.
That kind of, like, summarized the video.
That's what I figured.
Like, yeah.
It was kind of... Sorry.
Jordan, go.
No, it was kind of long, but I think actually hearing them talk and at the convention was actually easier to understand kind of what they were aiming at with the whole system. So I watched it, but the video was just a summary, I think, of the main points of it.
Yeah, for the first article, I have some notes down. I thought it was kind of back to the future that the patients don't know if the treatment they're getting is not based on science, and that millions of patients are getting chaotic medication therapy. It's based on what the psychologists are using their personal experience rather than science, and that's not good. So that was my summary on the first one, and the first one didn't talk about the new program, but it talked about how making a new program will help with the future generation, and it doesn't help a lot of people now. So it's really important for the future generation to use the new program.
Yeah, so from the first article, I found it interesting how 1/3 of patients get better no matter what therapy they get. So it doesn't really matter if the psychologist attributes them or give them the wrong treatment. Sometimes they'll think it's effective, but it may not even be that treatment. It may just be that they got better on their own or from some other factor. So I thought that was interesting.
I also saw that part. Oh, sorry.
No, you go.
I guess, when they said that they value personal experience more than research evidence, obviously that's, bad. Obviously they should be spending, paying more attention to the research, but I also kind of feel like personal experience is kind of, part of, psychology. I mean, obviously we shouldn't be moving so far away from the science, but, I feel like personal experience, just, relating to your patients is kind of, important, and, having to be, someone that you can relate to, I feel like is an important quality in, a therapist.
Yeah, if, clinicians are, using a certain therapy technique and it's been successful for their patients, and, from this person's experience, I agree with you, they can...
Right.
Equally accurate results because they know it works, and then even if they're scientifically based, if they haven't been used yet, it's that may not be as good either.
Right.
Yeah, I agree. I feel like for therapists, the ones that are more one-on-one with the patient, they definitely should have more personal experience because they should have the human, more human social skills. But the people behind them, they're above them, supervising them, they should have more science because they're gonna help shape the new generation. I think that was a big point. On the supervision, clinical psychologists should be more in supervising the people that are going to be the first responders, the therapists. So yeah.
I honestly just thought it was interesting how there is the fight between psychologists, and you would think that everyone's kind of on even though there's different types, everyone's on the same wavelength and process, but there's so many different types of research and ways to go about it, just like with how some psychologists are more into research and then others are just not, which is interesting because I feel like research is a very important aspect of psychology and constantly changing different ways that we go about it. So I feel like reading this, it was very different than what I would have expected. As across all different forms of psychology and stuff like that.
Yeah, I feel like since research is objective, it's supposed to be, and then personal experience is more subjective. That's why I think this personal experience part has been working, and that's why they say the field of psychology is it could end up getting worse because then people aren't gonna trust it and stuff like that. And we don't want that because like psychology is like a really good field and it should be like accredited. So.
Right.
Also, I feel like, sorry.
Oh no, you go. You can go.
I think like the fight over like the distinction between like this was one of the points in the video, like between training people as a scientist or in the science. So like I think that's more like the argument. Like how should clinical psychologists be trained? And I don't know. I feel like it's more in the science. Like the scientists are the ones, they're not going to be with the patients. So it's going to be like in the labs, maybe doing more studies and research. But I think they're trying to get more of the psychology into research, because another point I saw was that clinical psychologists aren't taking accountability for the care because there's not much supervision over them, and no one's really looking over their shoulder. And like maybe they have to have someone more be on top of the therapist and the clinical psychologist, because they're assuming that they're doing the right work because they're like checking it off and saying that they are.
Right. Yeah, I was thinking about like how, like, what are like ways that they could like combat that issue of like nobody looking over their shoulder, like, and like how is this really working? Because that's like obviously very hard to prove.
What are they gonna have, like someone like in a therapy system, someone just like
right
administration like watching the session? It's like not like allowed.
Right. Yeah, like I don't even know how they would like combat that.
I think it's also interesting, like, when you get into, like, medications and stuff, because that is, like, a very big part of, like, psychology treatment that, like, certain people agree with and don't agree with, which is where, like, I think, like, that, like, the medical aspect is, because, like, certain psychologists, like, can't prescribe medications, like, you have to go to, like, another, like, doctor to get that, which is, like, I've seen, like with, like, the personal experiences and stuff, like, certain, like, psychiatrists and, like, when it gets more clinical, we'll just like prescribe the medications and like this is what you have, this is what you're gonna get, rather than like really breaking down the issue, seeing if that's really necessary. So I think that's like something interesting, and also like that could even go into like the higher ups kind of thing, how like not like higher up, but like they can't like prescribe medicine, which is like a kind of a big thing in like certain aspects, and then like they need to go to that second person who might have more like qualifications than them, which is like, I don't know, could be like kind of like, I don't know, what's the word I'm thinking of? Like it like kind of like maybe degrading, kind of, not really. That's kind of a bold word, but the only one I can think of right now where it's like you have to go to someone to like prove that you're like doing this correctly. It's like, I don't know.
Yeah, I also was like thinking about like the whole issue with like prescribing meds and like just how like the average like psychologist can't, you have to be like a psychiatrist or whatever. And I was like thinking, because like my like primary doctor, like obviously she's like not really like a psychologist, like she doesn't have much like psych training, but she can like prescribe meds. So like how, like, why is it okay for her to like prescribe like psychiatric meds but not like a psychologist that actually like knows probably more about psych but didn't go to like med school? Like, you know what I mean?
No, I agree, because like my brother has a psychiatrist and he's like a therapist and stuff and like psychologist. And I think the therapy part, they know more about him, and then like the psychiatrist meets with him maybe for like 20 minutes
Yeah.
a week thing, or not even a week, a month or something. So it's like there's been so many problems with his medication. They had to give him new ones because it was like the wrong one. And a lot of psychiatrists he had weren't like that. Like they gave him totally wrong medication. He actually has one that's good now. So I feel like maybe in the future it'd be good if like people like clinicians should be trained that aren't like not just psychiatrists. Maybe like the like counseling psychologists should be trained in like medicine and stuff like that. I feel like that may be helpful.
Right, or like have some type of like, oh, like if I'm gonna prescribe you this medicine, you have to go see like a therapist. Because like I'm on like an anxiety medication that I just go to like my primary, but like I don't do like any type of therapy, and it's like, I mean, I guess I'm not that bad because it's like anxiety, but like if I was like depressed, like, and I was like getting treatment for like depression from her, like I wouldn't be going to like therapy. I'm just getting like meds, which I feel like it's kind of messed up.
No, yeah, like it's weird how psychiatrists, they're the ones who go to med school and they have the most training, but they're more like the counseling psychologists, the therapists, school psychologists, they're more looked down on, but they do a lot of the work. I think they do most of the work, and maybe they have more difficult time because they don't have that training. Like maybe, or I feel like the problems that like psychiatrists have, like, do people really like, are people aware of how medication, like my brother, like the problems and all of that? Like I feel like psychiatrists, they're just, since they already have a high, like they're looked up as really highly, that they don't really look at them, but they look up more like the majority of it, which is like the therapist and like psychologist. So I feel like a lot of the problem is like for the different professions, like what goes into each profession. I feel like it's like now it's like they're like mixing them together, or they're not really having a distinction. So like they want everyone to be treated the same, but they're not treating them the same.
Right.
Like the second article, so I was a little confused. Like, were they saying that like, so APA, that's like the current program, it's created by them, but that one is like they're saying it's failing and stuff because the clinical training programs aren't like having practitioners that are using like science-based treatment. So it's like, are they going away from the APA and they're doing like the new one? Is that like what's happening?
Yeah, I think they're trying to make a new, like, I guess, system, but in the video they're more saying it's not just about the system, it's about the other like factors. But I think it's I'm not sure it's going to replace it.
Is it still like a new one going to be accredited by APA, or is it like?
I thought that the new one would be called the Psych Clinical Science Accreditation System, so I think it's totally different than the APA.
Yeah.
But,
also, sorry.
What side of like the argument are you guys on for that? Like, are you for the new system? Or are you for like what that Steven guy was saying? Like with the just making new research like more available, like how like doctors get it.
I was actually going to say that, like, I saw that part. They want to make research more available to the practitioners and have more reviews and literature, because apparently that's done in every other field but psychology. I think that's why psychology is such a like I guess it's not like failing, but it needs a lot of work done on the field. So I don't really know what side I'm on, to be honest.
I feel like based on the way we're all talking about it, is it like Tony Zeiss, like one of the people in the video, and she's mentioned in the article, she says that like the therapists, like they need to be trained as both clinicians and researchers, and that's what we were saying before. Like, maybe it's like since they know better, they should be trained also in like the like clinical part, and then also like said that we need to get the work of clinical researchers into the hands of therapists. So I guess I'm on like the side of like the new system, and like basically saying that like the therapists are the ones that like know most, so I guess they should be trained more than they are. I guess I don't know.
I think that is like what we were just like talking about with the other article, and like the medication stuff. How like both sides like need to know all the information if they're gonna work together in that aspect, because like the therapist does like all that personal stuff with the client, whatever, and then the medical practitioner is prescribing the medications. So if they don't have like that therapist as like the connecting point, then they need that other level of research to properly like be able to assess that and like establish that like proper relationship to make sure they're not like prescribing the wrong medications, because then that can just end really badly for, especially when it comes to like mental health and stuff. Like I definitely think like making research more accessible is like a better idea.
Yeah, definitely. Also, there's something else I like highlighted. So I think they're trying to get like mental disorders the same respect, or like same like to take mental disorders as seriously as like physical health like problems. And for a while they were saying how mind and body are separate, but since the brain is like plastic, it changes and stuff, that there really are they shouldn't be taken as separate, and they're not getting as much funding for mental health disorders, and that's why therapists are paid less, and also for they want to go to a higher level professional. It's so expensive to get that kind of care. They need more funding for that. So I think it's just more of awareness for mental health disorders like that. They're it's not just in your head; it's actually mental health should be taken as seriously as physical health.
Yeah, also from the video, I to note that they said that there's many psychological tests that out there that are so accurate and not being used. So the clinical psychologists need to be trained in that. So that's a problem. There's more out there than what we're using. So I guess since they're using, before we mentioned, they're using things that from their experience. I guess they need to more education, more training beyond just getting the degree. You gotta keep educating yourself on new tests that are out there.
I guess one in the video when they were talking about should they be trained as scientists, or should they just be trained so that they know how to use and apply science? And I don't know, to me, I don't know if we have to be a scientist, but obviously understanding science is important. But I just think to have to teach them how to be a scientist would just take a lot of time.
Yeah. No, I agree. I feel like it should be more how to apply the science.
Right.
I'm not really sure what the training involves. Obviously it's more expensive to be a scientist, but I feel like maybe some of the professionals should be trained as scientists, but most of them just should have a science background. Right. To understand the brain and stuff.
Right, and I was also I don't think we all need to be researchers, but to understand the research and apply it is important.
Yeah. I think it's important for some people to do studies and take part in that, but that should be separate. But I think maybe everyone should at least be involved in, or should have not assignment, but should have in their career should look at articles and look at studies and respond to them, or do their own research on the side, along with their career, just to keep up with it, with the new methods and stuff coming out.
Maybe could there be mandatory?
Yeah, I was trying to get at that. Yes, I feel like there should be, because once you went to the schooling and got your job or in your profession, you don't have to do that anymore. But maybe they should have.
Right, just maintain your license or something.
Yeah, they do. I'm curious. Honestly, I don't know if they do, but they should.
Yeah, they probably do to some degree, but maybe not enough. I don't know.
Anything else anyone found interesting?
Yeah, I thought mentioned a couple times in the video and also the article. There's a shortage of workers, and I wonder why there's a shortage. I'm not sure if it means I think fine. Yeah, shortage of therapists. I don't know if it's because they're not paid as much as other fields and stuff, and I think you need more. It's really important to have the not have a shortage of them, because they're the ones working every day with people. So I thought it was interesting. I wonder because they said that the new system doesn't address the current shortage of therapists. So
I think pay could definitely be a big thing, but also just how difficult the job can be. Obviously the goal is to help people, but I think it can get very draining. Just not obviously it's very rewarding, but just the constant dealing with negative things, being told you want to help people, but that can also affect you negatively, which is I think why it's important that therapists do have their own therapist. But I think just with how if how recent was this? Recent? Yes. No. So like mental health has obviously like changed a lot recently. So I feel like at that point, like if there's a shortage of like therapists, then I don't really know where it is now. But I definitely think that could be like a big aspect of it, just like pay and then like how hard the job can get a lot of the times.
Yeah, I feel like they're getting discouraged. I mean, it's still a growing like a lot. I mean, I think a lot of people are therapists. It's still a growing field. I think it improved recently, but I think for a while it was like just people were discouraged to do it. You know, the pay or just the the toll on them. But and I feel like a lot of people are trying to find more professions where they get like make more money and they're like doing other fields. But like if you're really passionate about it and it's like the reward is like enough for you just from like helping people. But um, yeah,